Hello, this is Dr. Kwun calling from Bellevue Surgery. Is this Jennifer Griffith?
Yes, this is me.
It's a good time to speak to you, Jennifer.
Yes, it is. I've been trying to call for ages, so definitely now it is fine.
I'm sorry that it took you a long time before you could get an appointment. Unfortunately, we've been quite busy, but I'm glad that I'm able to speak to you today. May I confirm what's your date of birth, please?
12th of July, 99.
That's great. So, how can I help, Jennifer?
So, as I said, I've been trying to call for ages because now I'm just super busy at work and I have a super bad sore throat. I'm started coughing a lot. Everyone at work is super annoyed at me because I cough so much. And so first I've been told to go to the pharmacy. So I've been there and they gave me some paracetamol and some stuff like that. It didn't really help me. So now that's why I am back here. And I'd love to have some antibiotics maybe because I'm kind of scared it might be a chest infection. I don't know if you could give me something so I can get those antibiotics.
I hear what you're saying. So it sounds like you've had this awful cough and you've tried paracetamol and the pharmacy advised you to actually try that, is it?
I don't know. I probably did by my own at the beginning because I always take paracetamol if I'm not feeling quite good. And but they gave me the same thing at the pharmacist. I also tried a syrup for sore throat, but it didn't change. I mean, the sore throat did got a bit better because my throat doesn't hurt so much as last week, but I'm just coughing the whole day
So what did the pharmacist tell you, Jennifer?
to take some paracetamol
All right. Okay.
and to go back to you to
Mm,
make the important.
okay. So this cough that you've been having started with a sore throat, from what I'm hearing so far. Can you tell me when you're coughing, are you bringing up anything at all? Any blood or any mucus?
No, no, no.
No. Okay.
Clear.
And have you had any problem with your breathing?
No,
No. Any problem like chest pain?
no. It's really my throat and my nose has been really I had a runny nose for the past week.
Can I check, have you had any fever at all?
No,
Have you noticed any changes in your voice?
no,
No. And have you had any weight loss?
no, I don't think so.
Hmm. And may I check with you whether have you had a COVID test recently?
I did, of course, yeah. Yesterday I took one. It was negative.
Okay. So have you been able to eat and drink because you've had this sore throat?
Yes, I've been able.
Okay. And you mentioned that you worried that this was a chest infection. What made you think it could be a chest infection?
Yeah, because I had pneumonia a few years back, and I really didn't want to go through all of that again. And still, I looked on in the internet the symptoms of chest infection. I think, and I don't know. I think it could be because of the sore throat, the coughing, and everything. And I just think maybe it could be a good idea to have some antibiotics just to make sure. You know what I mean?
I appreciate what you're saying. This is definitely something we can talk shortly, but I just need to ask you a
Right.
few more
Sure.
questions. I
Yeah.
can see on your record that you smoke. Are you still smoking, Jennifer?
Yeah. Yes, I do.
Can I check, is it still 15 rolls a day?
Yeah, I have more or less. Yeah.
Okay. And with this cough that you're getting, sounds like it's been affecting you quite a lot. And you also mentioned about how is it disrupting things at work.
Yes.
May I ask you, what is it that you do?
I'm a sales manager.
Okay. And has this cough affected what you can do at work?
Well, it's just you don't feel so good when you're coughing all the time. I can't focus, and I really need to be very focused now because I've just been promoted. So I really need to be there. I cannot take days off or anything. And everyone around me is kind of scared. And, nowadays everyone is scared because of COVID and everything. And so I've been wearing a mask and well, I just want to get rid of this.
I hear what you're saying. So yeah, it looks like this cough is quite disruptive and affecting you a lot.
Yeah,
And you've tried the paracetamol and you've tried cough syrup, but it hasn't improved. And now you're thinking you might need some antibiotics. Okay.
exactly. Mhm.
So from hearing what you've said today,
Mm.
I do think that this cough that you've got and the concern that it could be a chest infection is definitely valid. However, I think it's very important that we're careful about prescribing your antibiotic, because sometimes if this is not a chest infection where you need antibiotic, then antibiotic might not be beneficial. It can actually have adverse effects, such as...
Right. I understand, but if I think the other times I took antibiotics, it really helped me. And I have a friend who took antibiotics like a few weeks ago, and she felt way better afterwards. So I was thinking maybe it might be a good idea anyways.
If you found this video useful so far, you might be interested in, are you ready to take the RCA test? This is a test that you can take where we're going to look at your answers and check whether you're ready to take the RCA based on your mindset, the strategies that you're using, and the consultation skills. The test only takes 60 seconds and you get more insights into your preparation and how ready are you to sit the RCA. All you have to do is click the link down in the description below and you can take the test free of charge. Yeah, I think antibiotic has a place where there is signs of any bacterial infection. At the moment, from what I'm hearing, it sounds like this started with a sore throat and runny nose, which suggests it could be related to more of a viral cause. However, I appreciate that you're worried that this could be a chest infection and you've had a history of pneumonia.
Yeah.
So, and you don't want things to get worse,
Of
which
course.
is completely normal.
Yeah.
What I would say is that yeah, antibiotic can have other problems apart from just side effect. It can also have problems where you can develop resistance if you actually take antibiotic when you don't need it, such that when you actually develop an infection in the future, then the antibiotic might not be very effective, which is why we're careful when we prescribe antibiotic.
Okay, yeah, I understand.
So what I'm thinking here is that if you're quite worried, the best thing would be if we actually see you in the surgery. I can arrange to book you for an appointment so that we can have a listen to your chest to see whether there's any signs of an infection, and then decide whether we need to prescribe you antibiotic or not.
And isn't there any way to do this online or something? So I'm really quite busy lately and I'm not sure if I have time to come to the surgery.
I appreciate you're busy. I think it's one of those assessment where online is difficult to do because it's very difficult to be able to listen to your chest without seeing you, and putting the stethoscope on your chest and have a listen. So we can give you available slots that might suit you depending on what time would be suitable for you.
Okay, I appreciate that. Yeah.
Okay. You mentioned you're still smoking 15 rolls a day. Have you had any thoughts of cutting down?
Not really, but usually I'm not sick. I think it might be, like the winter, or there's a lot of things going on right now. Just my chest, I don't know, but I've been smoking for ages and I'm fine.
Right. It's just because I'm not sure whether somebody has already said this to you in the past, but smoking has detrimental effect to your lungs.
Yeah, I know.
So that's why I just wanted to raise that to you. But if at the moment you don't feel you need any help and you don't think that you want to cut down, but we're always here if you do need help. If you change your mind in the future,
thank you very much.
Then we'll be happy to help you. Okay.
All right. Yes.
So what I would suggest is that if we book you at 6 o'clock, would you be able to come down for 6 o'clock
this afternoon?
Yes.
Yes, perfect. I'll manage. Yeah.
All right. So then we can examine you, and then if you do have any signs of chest infection, then I would prescribe an antibiotic called amoxicillin. This is quite effective for chest infection. And if there's no signs of an infection, then I would give you some advice. One of the things I would say is that, the cough syrup is not something I would recommend to carry on.
Okay.
Because when you have any infection and you're using this cough syrup, what happens is that it's going to stop you from coughing up anything that you need to bring up, and it might take longer for this to recover. So that's why I would say to avoid cough syrup. All right.
Yes, I won't take them then.
So when you calm down, what I would suggest is that please bring a mask, and we'll see you in one of the red zone area. All right.
Okay.
So if you wait in the car park, the receptionist will give you a ring at 6 o'clock, and then when we're ready to see you, then the receptionist will let you know. Okay.
Perfect. Yeah, thank you.
If you found this video useful, then I'm sure you're going to get a lot from watching this video where I talk about mistakes that registrars make with the RCA. Click the video to watch it. Take care, everybody. Bye-bye.